again, we are back on Boond Soch ki ttalk, train of thought, with a series of episode with Dr. Viswanathan Iyer, who is a chief neurosurgeon and MD with Qualilife and also in cycling mayor of Mumbai. It's an interesting insights to what we are getting from him for our target audience, for the medical practitioners and for the athlete too. Sir, welcome once again to this ttalk Boond Soch. Now, sir, how would you compare neurology, psychiatric, and neurosurgeon, for our target audience,
Okay, so ultimately, in short, neurosurgery, neurology, and psychiatry all are dealing with brain and spine only.
Mm-hmm.
But if you really broadly want to classify them, a neurosurgeon does surgical procedures for the brain, spine, and the nerves.
Mm-hmm.
A neurologist is more into diagnosis and medical management of neurological problems.
Mm-hmm.
So he does not do surgeries.
Mm-hmm.
And a psychiatrist is a mental health professional
Mm-hmm.
who is dealing more with the psychological problems affected in the brain.
Oh.
So that is the broad classification of our professional,
Correct.
limits.
I'm sure those kind of insights will help in target audience. So what surgery do you often do than others
I think tumors becomes a very common kind of surgery.
Mm-hmm.
So even in neurosurgical career path, I think the acute or rather the night emergency calls and everything tend to go up or rather to a younger, if I may say so, neurosurgeon.
Mm-hmm.
And as you become more and more senior, you end up doing more of planned daytime surgeries, which involve more of brain tumors.
Okay. And in fact, so what do you think the challenges in the neurosurgery in the next 5 years or 10 years as for India which are concerned?
I think neurosurgery is probably one of the rapidly improving branches, if I may say so.
Mm-hmm.
And if you see the past of maybe 30 years back or 40 years back,
Mm-hmm.
neurosurgery, or at least the brain surgery,
Mm-hmm.
was involved with a lot of complications and things like that before maybe 40-50 years.
Mm-hmm.
In the last 40 years, 30 years, there have been lots of new inventions.
Mm-hmm.
I mean, just the fact that people were operating before 1981 without even a CT scan of the brain,
Correct.
you can't imagine today, isn't it?
Mm-hmm.
So today without MRI, you don't even
Correct.
touch the patient.
Correct.
So I think advances in radiology, CT scan, MRI, has now enabled us to exactly pinpoint the problem location in the brain, maybe the type of tumor also. So when you operate somebody, you already have your full, if I may say so, Google map of the brain ready. Second advancement which has happened is the advent or rather the use of micro neurosurgery or the use of operating microscope in the theatre, which is no more a special thing. Every neurosurgery theatre has an operating microscope, and that helps you to get illumination inside the brain, magnification, and because of that the results are much better, and the chances of problems and complications are very less. So in today's neurosurgery, I think the results are really, God willing, very great.
Nice. Also, when you started your medical practices at that time, maybe I think when we talk in terms of technology was not that to that extent. But now when we talk in terms of artificial intelligence, the things are changing fast. So how, as a medical profession, you cope up with those kind of technology?
I think in MBBS or in neurosurgery, for the matter, as a doctor, we have to keep improving our skill sets. So that's why we have continuing medical education programs.
Correct.
So even as a surgeon, you do have to keep brushing your skills. So learning any new technique is going to be a challenge, but I don't think it's impossible.
Yeah.
Artificial intelligence is not going to enter neurosurgery in a very big way, at least in the near foreseeable future. It is more going to affect pathology and radiology, but I'm sure ultimately it will benefit.
Okay. Can you also throw in light for target audience, another type of surgery we talk in terms of an awake craniotomy?
Yeah, I think it's a term first time when you listen to it, you find it how do you operate a brain when the patient is awake? It's like a question which always involves a lot of curiosity from the audience. What happens? We don't do it every time. So all the neurosurgeries are done with proper anesthesia where the patient is really comfortable. So he doesn't have to go through the pain. In certain tumor locations, suppose the tumor of the patient is in a speech area, the area which controls his speech. So if I give him full anesthesia and if I operate, there may be a chance of a damage to his speech area. So this awake craniotomy, we limited usage to only tumors which are located in very, very important areas of the brain. So as an example, if I'm operating somebody with a tumor in the speech area, we prime him before surgery. Okay, we are going to give you only local anesthesia. You will not be totally anesthetic. Any problem you can communicate with us. So the skin and the bone has pain.
Correct.
So we give anesthesia locally to prevent that pain from disturbing the patient. Once we are on the brain, there is no pain. So when we are operating a brain tumor and we are touching the brain itself does not have pain perception.
Okay.
So what we do, we operate the tumor and we keep asking him to communicate with us. So there are a set of pre-planned questions which the anesthetist has discussed with him.
Okay.
So during the surgery, she will keep on asking him, okay, we discussed this yesterday, how are you feeling now, this, that. So when we are removing the tumor, she is making sure that we are not affecting the speech area. So with this awake craniotomy, we also achieve a good, better tumor removal, and we are definitely going to save his speech after surgery. So that is the advent of awake craniotomy, and it is used. It's really magical. I mean, and you must have heard of certain stories where the patient is actually playing the violin when he's getting operated.
Yeah.
So it is. So if a musician has to have a surgery, you have to make sure that he doesn't lose his music, skills.
Correct.
Because that may be his professional career. So we do have awake craniotomy for such cases also.
Oh, I see. In fact, Dr. Viswanathan Iyer, I'm sure that's what ttalk platform is all about, where I think the experts like you come and share the real insights as far as your medical profession which are concerned. And in fact, you have touched upon as the neurosurgery which is concerned, and also in terms of how does the brain function and all. I'm sure do catch up with Dr. Viswanathan Iyer in our next episode of ttalk Boond Soch, and as a medical professional and also as a cycling mayor of Mumbai, where he had met with an accident, then he coped up post-accident, and now he's very active as far as the cycling community which is concerned. So do catch up with him on ttalk Boond Soch. Thank you very much. So thanks a lot for spending valuable time.
Thank you.